Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Self-Instructions for the Expression of Negative and Critical Emotions, Part 2. Self-Instructions for Receiving Criticism. Preliminary Components. Receiving negative criticism can be helpful. Getting it wrong is how you learn, and when someone makes you see a mistake or gives you a different opinion, the best thing to do is to take advantage of it. Knowing how to receive criticism increases the control of conflictive relationships, improves self-confidence, and allows us to take better advantage of events, not wasting too much energy and time because of susceptibility. When responding to criticism, the tone in which it is made is important, as the person who is criticizing does not have to feel attacked. Two important rules: do not deny any criticism, and do not counterattack with another criticism. Verbal behavior. Do not counterattack with another criticism. Do not apologize repeatedly and excessively. Do not bluntly admit mistakes that have not been made. In any case, admit the possibility that the other person is right. It is possible, maybe. Ask for details. Check the exact content of the criticism. Help the other person to express his or her criticism. What, how, why, where. Wait for the other person to finish speaking before we do so, avoiding interruptions. When the criticism is justified, even if it is only half justified, we must agree with the criticism. There are several possible ways. Clearly and immediately admit the mistake made. Acknowledge whatever truth we find the criticism. Acknowledge the possibility of truth in mind. It is possible you may be right. When the criticism is unfounded or not constructive but harmful. Some useful defensive procedures. Record keeping. Continuously repeating the main point of the message without paying attention to other content. Negative assertion. When the criticism is hostile but a mistake has been made, quickly acknowledge the mistake. Cutting back. Answering yes or no, waiting for the other person to clarify the criticism before responding. Selectively ignore unfair, destructive, guilt-producing aspects. Ignore always you are and respond only to what is not offensive. Separate the issues. Ask questions. Non-verbal behavior. Do not be aggressive or ironic. Do not ridicule the interlocutor. Do not minimize or give too much importance to the criticism. Listen carefully to the criticism. Pay attention to the non-verbal components. Try to appear neutral. Pay attention to what the other person may be right. Wait for the interlocutor to finish speaking. Send non-verbal signals of active listening, nodding, shaking the head, etc. Eye contact. Tone. After listening, we will speak with a firm and not altered tone. Volume. After listening, we speak at an audible volume and without shouting. Look. We listen with an attentive look at our interlocutor, but with a relaxed face. Distance. Depending on the situation, but in general not too close, to avoid it being interpreted as aggression. As we have seen, training in self-instructions involves establishing appropriate internal verbalizations that enable the performance or coping with a given task, situation, or event. Since the fundamental objective is to teach the person to use self-instructions that allow him or her to successfully guide his or her own behavior, it is important that it is the subject, him or herself, not the therapist, who generates as many self-verbalizations as possible, according to their type of vocabulary or their most habitual form of expression. The effectiveness of this technique in adults with problems of anxiety, self-control, stress, pain, etc. has been fully proven. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Sleep Phases and Disorder Part 1. Remember, in the description of this video you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next video. Thank you very much.